Dr. Michael Ryan answering the question, how do I treat phlebitis? Well, after you get the diagnosis of phlebitis from your healthcare provider, one of the things you want to make sure is to establish whether it's necessary to get an ultrasound. Most of the time, it will be important to get an ultrasound. Under rare circumstances, that wouldn't be needed, but for most patients, that's a safe thing to do because you want to know if there's any other blood clots in your body. So once you get that established and there's no other serious problems, there are different options that can be effective. If the vein is quite large and is in this location where the vein is leading directly into a deep vein, like in the upper thigh, then actually being on blood thinners is a good idea, at least temporarily. That's something that you have to determine with your healthcare provider. In general, when there's inflammation, you want to get an anti-inflammatory medication started. It could be non-steroidal medicines like Aleve or ibuprofen. Aspirin is also an option, but often less tolerated for stomach upset. And then finally, steroid medicine is something that's very effective. Patients that are suffering from phlebitis, which can last for weeks, getting on steroid medicine can really make a big difference and give them the relief that they were missing. Understanding that once the inflammation gets revved up in their vein, the steroid medicine will improve it, but it won't make it completely go away, because that's the nature of inflammation. Once it gets started, you can't really make it completely go away. Ice will help too. In the early phase, ice is very important because ice immobilizes the inflammation response and also reduces the swelling. So ice is helpful. At some point, you can try heat, and you'll know whether it's the time to try heat, because if you try heat and it hurts more, then it's still needing ice to keep everything simmered down. So those are the main therapies for treating phlebitis, and tincture of time is the thing that really is necessary, that no one likes to hear that, but it takes weeks for phlebitis to resolve. So Dr. Michael Ryan answering the question, how do I treat phlebitis?